Today we're going to demonstrate our new technique for remplissage with the knotless 4.75 swivel locks. This can be beneficial in certain patients with softer bone, especially in these Hill-Sachs lesions, where some of the lower profile anchors have trouble holding as well. We've debrided this with a meniscal curette followed by a shaver. You can see we have the arm in external rotation with no traction on. We have a Gemini cannula to allow us to pull away from the soft tissues and give us enough space back there. Here we're entering and placing the inferior 4.75 swivel lock, which is biocomposite, into the bone. You can see that we will be removing this, and we have the completely knotless function available with the large suture. We'll place a second 4.75 swivel lock. And we'll leave these in the Gemini cannula, which is in the posterior cannula. We use 2 spinal needles to localize, and we make a posterior lateral portal but do not go through the cuff tendon, and we have this in the subacromial space. We use a 17 gauge spinal needle to pass a PDS suture, and then we pass the inferior sutures through the one part of the infraspinatus tendon, and then we do something in similar fashion, roughly 1 to 1.5 centimeters superior in the infraspinatus tendon, and pass the second set of sutures. Care needs to be taken not to tangle these sutures, as it will be more difficult to do the locking mechanism. Here we've done and completed the labral repair anteriorly, and now we'll go back to the Hill-Sachs lesion and sequentially tighten the Hill-Sachs lesion back to and you can see here that we're gradually pulling the soft tissues away. We've engaged the locking mechanism on both the superior and inferior anchors, and finally we're able to get the complete fixation down to the Hill-Sachs lesion. This was in a quite large lesion.